Hi, everyone. My name is Jessica Boehm. I am a reporter at the Arizona Republic in Phoenix. I actually cover housing instability and homelessness full time. I have been with the paper for 6 years, but I just started this new beat somewhat recently, though homelessness and affordable housing have always been big passions of mine and major coverage points of mine. I am a native Arizonan, but I have been to Oregon many times and wish I could be there now with all of you. But I suppose the world is keeping all of us apart right now, and we will learn to live with that. I'm hoping today to give you a brief overview of the state of homelessness in Maricopa County, which is our largest county in Arizona. It is where Phoenix and all of our major suburbs are. And when I say suburbs, I'm talking about 10 cities that range in size from about 150,000 to 500,000. So we're a pretty large area. We're the fourth largest county in the country and the fifth largest city in the country with Phoenix. So I'm hopeful that I can give you an overview of our situation with homelessness and also walk you through how we responded to COVID-19 in that population. So if you'll bear with me for a second, I'm going to share my screen and we'll get going. Awesome. I'll go ahead and make my face a little bit bigger so you can still see me as we're going through this. But awesome. Okay, so let's get going. So let's talk about where we were at the start of 2020 before we knew COVID-19 was about to change all of our lives for a long time. When we did our point in time count in January, which is of course not perfect and likely an undercount, we found 7,400 people experiencing homelessness in our county. Now, if you look back the last 5 years, you can see that our overall homeless numbers have been ticking upward for 6 years now. Now, equally concerning, if you look at the bottom part of that graph, the orange part, you can see that our unsheltered numbers have been increasing significantly at an even higher amount than the total homeless population. And this is really because of a number of factors. First of all, we are on the short side of shelter beds in Metro Phoenix. And I'm going to say Metro Phoenix and Maricopa County interchangeably. They're basically the same thing, but just so you know. So the numbers that you're looking at here, I will say these are just emergency shelter beds. So obviously there are other types of shelter that are not showing up on this list that we do have access to. But we still have what most providers would see as a shortage of shelter beds in our community. So we have a total of a little over 1,700 emergency shelter beds. 110 of those are reserved for medical patients. 730, one of them are family shelter. Another 200 are things like domestic violence, youth, specialized shelters for specialized populations. And then we have 708 single adult beds, which I think are probably the best thing to look at because those are the beds that you can get regardless of your circumstance. And when you see that we have 708 single adult beds and, you know, a total homeless population of 7,400, which we know is probably an undercount, you can see why we're seeing such a large number of unsheltered population. So just for your background, 470 of our 708 single adult beds are at a single shelter, our largest shelter in the state. That is the Central Arizona Shelter Services Shelter, or CAS as we call it. I'll probably slip and say that at some point, so just so you know my acronyms. And that is part of the Human Services Campus, which is a congregation of about 20 nonprofits just south of downtown Phoenix that offer services to our homeless population. So as I noted, we have an undersupply of emergency shelter beds generally. And there have been pushes in recent years for additional shelter beds. Those have been mostly met with a lot of opposition. There's currently a zoning request going through our city council to double the number of emergency shelter beds that we could have at the Cass campus. And that has been met with a lot of pushback. A lot of people believe that it's a better situation to have smaller shelters across the region than to congregate such a large population in one neighborhood. I think most people actually do agree with that, but at this point, we are not seeing many neighborhoods like putting their hand up and saying that they're, welcoming to this population in their neighborhood. So basically, what we're seeing is we have communities who don't want more shelter beds in existing shelters. And we also don't want more shelters generally. We say we do, but when it comes to actually citing a location, it doesn't get very far. So we really, pre-COVID, are having this, conversation in our region about what shelter beds should look like. So that's why we're seeing, or part of the reason why we're seeing such a large number of unsheltered individuals in our population. We've also gotten rid of overflow shelter at Cass or near Cass. So, a few years ago, we had an additional 200 to 300 people with a roof over their head, and we don't have that anymore. So this is, and I'm not going to read through all of these, but if you would like to, you're welcome to. But this is just a little bit of a background as to why I think we're seeing more homelessness generally, not just unsheltered, but you also saw that full bar graph continue to tick up over the last couple of years. So we, in Phoenix, in every city in the country, we've always had people experiencing homelessness in our community. But that was a pretty contained population for a long time. It was typically people who were dealing with pretty intense situations regarding addiction, mental health, the criminal justice system, or other very specific needs. What we're seeing now is more economic factors playing a role in why people are becoming homeless. And that's really new for us in Arizona. Metro Phoenix has always kind of been like this mecca of affordability. You see affordable housing crises in LA and Seattle, all over the East Coast. We've never seen that before. In fact, people moved to Arizona often because they could afford it. And so that really offered a decent quality of life for people at all income brackets for a long time. But in the last several years, we've seen record prices in both our housing prices and rental prices, and you're really not finding reprieve anywhere. So all of this is before COVID-19. We were seeing rents climb at unprecedented rates and really just creating a big problem in our housing market, something that we've seen, a phenomenon we've seen that I think will only continue after COVID, is we're seeing a lot of people move from more expensive cities like Houston and LA to Phoenix and be able to keep their jobs working remotely. So they're bringing their Houston and LA wages into Phoenix, where our wages are so much lower and have definitely not increased with the housing market. And so it's pricing out a lot of people who were already living here. So, I'm giving you a broad overview of our housing market. I know you're here to talk about homelessness, but I think it's important to bring up because I really do believe that we are seeing more and more people pushed out of housing because of these economic factors. When people in our most vulnerable people or our lowest income families can't find housing that they can afford, they end up moving into places that they can afford. And then they miss rent and then they get evicted. And you can see we have one of the highest housing loss rates in the country in Maricopa County. And when you have an eviction on your record, it's just very hard to ever find a place to rent again. So, while all of these housing market things are part of a bigger issue, they really are causing a lot of homelessness in our community. So this is just kind of a background for you to understand where we were before COVID. Now I'd like to go back to March, the earliest days of March, when we started to realize that COVID was going to be a part of our life for probably a much longer time than any of us wish. So I'm a journalist, and that means that I'm not in the business of giving praise very often. But I will say I'm happy to praise the work that our homeless services providers and shelter providers did in those earliest days of COVID-19, because the immediate reaction by them, I think, without a doubt, saved lives in our sheltered homeless population, especially. So, when we first realized COVID-19's impact, people in these shelters, especially the really large one, Cass, that has 470 beds, realized we can't have 470 people congregating in a few rooms. That's not going to be a healthy situation. And what seemed like almost overnight, really, the Human Services campus in Cass were able to repurpose buildings on their campus, things like a day room or a cafeteria, into temporary shelter. And they partnered with their healthcare for the homeless provider to do basically medical evaluations of everyone on the campus, everyone who was staying in the shelter. And that really allowed them to create a system of ranking to see who was the most high risk. And people that fell into those like super high risk categories, either because of age or health risk, were then quarantined in special areas like the day room and the cafeteria, so that they were away from the general population until they could figure out what they were going to do long term. At the same time, the healthcare for the homeless provider Circle the City put up medical tents in the parking lot. And that was great in those beginning days when we didn't know, does everybody on the campus have COVID? Does nobody? It was all very confusing in those early days. That allowed there to be space for people to wait while they were waiting for their test results. So if you had symptoms or if you're around someone who was known to be positive, you had a place to go where you could quarantine and not get anyone else sick. Those, again, seem to go up overnight. And I will say also, all of the shelters in the Valley that I know of, the Valley is another name for Maricopa County. I'm sorry, we've got a lot of them. But all of the shelters in our area really implemented mask requirements and social distancing well before any of our government leaders put anything into effect. So there was this immediate, I think, response and realization by our service providers that if they didn't work very quickly, there could be a really tragic situation. And obviously, we all saw projections of the number of people who could die of this disease in the homeless population. And, thankfully, we have not seen that happen in Maricopa County. So I walked you through what happened in the immediate days. Over time, we've kind of changed the model. So those medical tents I told you about that the healthcare provider was offering, those worked really well at first in March and April, but I know you guys are from Oregon and have your own weather challenges, but we really have challenges with our summers, and it was extremely hot, and those were just no longer effective in the heat. So luckily, our county government provided funding for Circle the City to rent out a hotel that had closed and basically offer like full service healthcare to anyone who tested positive at that location. So it really worked a twofold. It gave them a place to stay, so they weren't getting anyone else sick, but it also, provided easy access for the medical providers to make sure they were taking care of those people who did test positive for COVID-19. At the same time, they kind of outgrew the day room and cafeteria areas for our vulnerable people. And both the city and the county provided funding for organizations to start housing people in other hotels. This hotel model became really popular really fast, and it's been pretty effective. So Cass has now rented out 100 rooms in a hotel in North Phoenix. It's actually, part of it is still used as a regular hotel, and the other part is rented out for seniors experiencing homelessness. I've been out there. It's really been impressive to see the additional attention people get in a more one-on-one setting. And I mean, also just to go from either being on the street or living in a congregate shelter setting to having your own bed and bathroom, like it's, everyone I've talked to has been very happy with that. And it's something that I think people hope could maybe continue long-term. We've also started other regional hotel programs to get more of this idea of regionalization. Let's not congregate everybody in downtown Phoenix. So the county has also provided, funding to rent anywhere from 25 to 50 rooms in other parts of Maricopa County as well. And that's really, I think, been the most strategic and effective thing that the providers have done for our sheltered population, because obviously there's a big risk when being sheltered is great and obviously important for long-term health and services purposes, but it's also really hard when you have hundreds of people in one room and you have a virus going around that spreads like wildfire. So the utilization of regional hotels and shelter programs, I think, was really effective. So now we go to our unsheltered population, which has its own set of, things that make it both easier and more difficult during COVID. Obviously, they weren't living inside. We know now that being outside is better for, not transmitting the disease, but being outside also can make your other health conditions worse, and that makes you a higher risk for more serious side effects of COVID-19. So this is specific to one part of the unsheltered population. So we know that the CDC said pretty early on that we shouldn't break up encampments because that would maybe cause people experiencing homelessness to then further disperse into other parts of the city and cause more issues with spreading the disease or the virus. So our largest encampment is on the streets surrounding the Human Services campus where the largest shelter is. There's anywhere from 300 to 500 people sleeping in tents outside the shelter every night. So Maricopa County decided to use 3 vacant parking lots near the campus, just walking distance from it, and basically draw these 12-foot by 12-foot squares on the pavement and have the people who were sleeping right in that area move on to the parking lot. And hopefully those markers would encourage people to social distance. There were also bathrooms and water facilities brought in, which they didn't have living on the street prior to that. So I would say there were mixed reviews on this. I go down there quite often. They're still open now. They're supposed to be there till the end of the year. And I've talked to some people who think it's great. They have toilet facilities now. They don't have, police officers waking them up every morning and threatening them with trespassing tickets. There are other people who don't like it that much, who feel like it's like a prison situation. There are, gates around it and security. And that's got good and bad. But the biggest issue, and one of the things that I think people were most concerned about, were the heat. This, as you can see in that photo, there was no shade. We spent a lot of our summer above 110 degrees. And, it did take a toll on that population. We unfortunately did see heat deaths in this community. That's not because of the safe outdoor space. That likely would have happened regardless, just because it does every year. And that, I think the visual though of this, it required more people to think about how hard it is to be in the heat and be homeless. And so it was a little controversial, but that is what our policymakers decided to do with part of our unsheltered population. people who were living unsheltered in other areas, either other encampments or just on their own throughout Maricopa County. There were programs from the healthcare provider to try to go out to those areas to educate people on the virus, to get them tested if they had symptoms, and to make sure that they knew about, mask and social distancing requirements as well. So there were several other things that the city and state and county spent money on during this time to help the homeless population through COVID-19. In addition to all the things I just mentioned, like the hotel programs, which were funded with CARES money, we had some other things as well. The city of Phoenix has a convention center. Obviously, conventions didn't really go on this summer. So they were able to take their convention hall and kind of turn it into a respite. So, obviously that's a very large space. So people were able to physically distance, but be inside during those harshest days of the summer. We also had all of those government entities provide CARES funding directly to food banks and other nonprofits for things like PPE and physical supplies, especially with the food bank. I mean, we had more people signing up to receive food than possibly ever before. The city of Phoenix also put more money into permanent supportive housing, rapid rehousing, and voucher programs with the hope that any of these people who go and stay in the hotels for temporary shelter won't discharge back to the street. So hopefully the people who are staying in those hotel programs now will have a safe place to live after this. That's the hope of that money. And then this isn't directly related to homelessness, but it is related to homelessness prevention, I believe. We had, well over $50 million going towards rental and mortgage assistance for people who couldn't make their rent or mortgage, which I think probably prevented a lot of homelessness. It probably isn't enough, however, and I think we're all a little concerned about what happens next in Maricopa County and throughout the country with evictions, and if that translates to more homelessness. So this is, I'm going to move my little face down here for a second. This is something that I think a lot of people think that a lot of good has come out of the city, county, and state funding as it relates to the homeless population and COVID-19. But the one thing I hear about missed opportunity is I think a lot of people hoped that there was a way to spend some of this money to get some long-term solutions. So as you all know, the CARES Act funding, which is most of the funding I was just discussing, expires at the end of the year. And we all know that more bad could be coming. Evictions are likely to start up again with haste in January, and that could will translate to more homelessness. So a lot of providers were really trying to push the city, the state, the county to invest in infrastructure that they could, yes, use now for COVID-19, but also use moving forward. So like an example, instead of, giving a provider $1 million to rent the hotel for seniors, was there a way that they could have used that money to purchase a hotel that they could use now and use after this? And we still have a month or so left, and maybe some of those purchases will come. But I think that's one thing that's kind of been, it was a missed opportunity when you had this much money for probably the first time ever coming in this arena. There is one good example, though. The city of Phoenix actually a few months ago learned that our U.S. Vets program, which houses 200 veterans, the landlord of the property they were renting to house these veterans decided to almost double their rent. And again, another consequence of the housing market I was discussing. And they didn't know where they were going to go or where they were going to house these veterans. And so the city of Phoenix actually stepped in and gave them $10.5 million to purchase a facility that they, yes, can use now for COVID-19 reasons, but also can have moving forward, and they'll no longer be, at the whim of the rental market, and they'll be able to house veterans indefinitely, hopefully. So that, I think, is an example of what a lot of people wished would have happened more. And then I'll move myself back up here. There's a few things that I've taken away from COVID-19 in the homeless population. The most important, I think, is that working together works, which sounds silly, but one of the most frustrating things covering, human services agencies and nonprofits and organizations is there are so many people who want to do good, but there's so many silos between those people sometimes. And a lot of times everyone's working in, 100 different directions trying to reach the same goal, which can be frustrating as an outsider to observe. Those silos broke down instantly when this happened. It was just clear that everybody realized that there was going to be a tragedy if they did not work together. And that collaboration it was impressive to see, and I hope it continues moving forward. I think it's the only way that we're going to have sustainable solutions to homelessness, and I really hope that everybody takes that lesson that they learned and realize that it's better to work together than to work alone. The other thing is, I know nobody likes to talk about how expensive solving homelessness is, but it is, and funding is important. And I think that this last year really proved that homelessness is solvable if we have the money to solve it. You just look at it, we're in the middle of a pandemic, and right now we are sheltering more people than we ever have because of the hotel programs. We are housing more people because there's more assistance in the housing programs. And we kept people safe and healthy during a global pandemic. I think that really goes to show you that if you put adequate resources towards something, it's not only, possible, but it's not even that difficult to solve this problem. You just need the money and you need people working together. And so I really hope that, providers can leverage this example to prove to their policymakers just how important money is in this solution finding. It's essential. And I think the cost is pretty low when the result is people being housed and ultimately saving lives. And these other two things kind of go hand in hand, but I do think, as horrible as this situation has been, it has forced people in Maricopa County to realize that we have a real housing problem. And we absolutely do. And I think people are now realizing that it's not just like, oh yeah, housing prices are going up. It's actually a crisis, and that we need to find a way to add more housing to our community that people can afford. And I think people I can see it. I am on a bunch of I attend different task force meetings and stuff, and people who never talked about affordable housing are talking about affordable housing. And that's one really great thing to come out of this. And then, this is probably very apparent to all of you, but this pandemic has just showed how weak our social safety net is, I think, in every state, but Arizona is definitely no exception. We've had more people apply for unemployment and rental assistance and other kind of government assistance than, probably ever before. And it really shows that we need to do a better job of making sure that people, have a safety net when these kinds of things happen. Hopefully we won't have another global pandemic in our lifetime, but we will have other emergencies. And I hope that this allows us to think more creatively about how to be sustainable. So that is my spiel. I am really excited to listen to the rest of the conference. I hope this was helpful to you all. As I mentioned I am now covering homelessness and housing insecurity full time. I'm very curious about how the rest of the West is handling this problem. So please feel free to reach out to me either by email or on Twitter. I'm happy to make your acquaintance, even if from a distance. So have a great rest of your conference, and thanks for inviting me to participate.